emphasizes the critical need for kidney health awareness, especially when over 100,000 Americans are on transplant waiting lists, with around 87% of those awaiting kidneys. Despite its prevalence, about 90% of kidney disease cases go undiagnosed, with 12 people dying daily while awaiting transplants. In 2022, the U.S. completed 499 kidney transplants, but as of February 2023, 658 Americans were still awaiting transplants. You wouldn't want to be among them, right? That's why early detection is key in combating kidney disease. But if you already have kidney disease, things are much more complex. While having kidney disease, the healing ability improves by adopting healthy habits such as regular exercise, managing other health conditions like high blood pressure and diabetes, avoiding smoking and excessive alcohol, and being cautious with medications like NSAIDs. But what really matters is making sure your meals are healthy, balanced, and kidney-friendly. A kidney-friendly diet can slow disease progression and further damage. It should prioritize lower amounts of sodium, protein, potassium, and phosphorus intake. This practice helps heal the buildup of waste products in the blood and controls blood pressure. The Mediterranean and DASH diets are recommended for those with kidney disease as they slow kidney disease progression and even reduce the risk of cardiovascular disease, a common risk factor for kidney disease. These diets are high in fiber and low in processed meats. Plus, these diets contain essential nutrients like magnesium and calcium while being low in sodium. However, you can still get a lot of potassium and phosphorus from these diets by eating certain foods. We've explained this in detail in our previous video, and you can check it out to see what foods you should avoid. Now, in this video, let's dive into what foods you should include in a kidney diet. We'll share valuable insights on incorporating kidney-friendly natural foods into your meals, offering practical and delicious ways to support and enhance kidney health. Before we dive in, kindly note that all information you'll find in this video is produced by humans, and for humans. You can visit our website at healthtoday.com to see our advisory board and the team behind these videos. We do not use artificial intelligence writing tools like ChatGPT to automatically generate content. Be assured our information is thoroughly fact-checked, unbiased, and reviewed by qualified professionals. Alright, it's time to swing back to the natural foods that support healing your kidneys. 10. Watermelon. Watermelon is traditionally known to protect against kidney diseases and help with urine flow. Native Americans have long used the fruit to treat water retention and kidney stones. Plus, its natural diuretic properties promote urine flow without straining the kidneys. Additionally, watermelon aids the liver in processing ammonia, easing kidney strain while eliminating excess fluids. Studies suggest that watermelon's diuretic action may rival that of prescription diuretics, making it a potential natural option for managing excess fluid. However, it's crucial to consult a healthcare provider before substituting watermelon for prescription diuretics. Moreover, watermelon is packed with antioxidants like lycopene, vitamin C, and citrulline, which have anti-inflammatory effects. Including watermelon in an anti-inflammatory diet can reduce body fat percentage, body mass index, and body weight. This can indirectly benefit your kidneys, as obesity is a common risk factor for kidney disease. A 2021 study in Current Research in Physiology investigated how watermelon rind extract could help rats with kidney and liver injury caused by lead acetate. They divided rats into groups and treated them with lead acetate alone or in combination with watermelon rind extract for 30 days. Lead toxicity caused kidney and liver damage, indicated by raised levels of certain substances in the blood and reduced antioxidant protection. However, treatment with watermelon rind extract reduced these damaging effects and enhanced antioxidant defenses, suggesting its potential to promote kidney health. So, next time you buy a watermelon, don't just throw the rind away. You can add it to your smoothie or juice for extra kidney benefits. Yet, note that a cup of diced watermelon provides you with 170 milligrams of potassium. If you have kidney disease, having the right amount of potassium in your diet is important. So, limit your watermelon serving to 1 or 2 cups a day. Also, be careful of any watermelon diet suggested online for kidney detox. Eating 2 servings of watermelon daily is safe, but sticking to a diet solely focused on watermelon or any one food isn't recommended. A watermelon cleanse is just a fad and can deprive your body of essential nutrients it needs. Are you enjoying our video so far? If so, please give us some hints by dropping a like, and we'll make more content like this. 9. Kale. Kale, a nutrient-rich leafy green vegetable, belongs to the Brassica oleracea family, along with cabbage and broccoli. It's low in calories, yet packed with essential nutrients like vitamins A, B6, C, K, folate, fiber, and manganese. Additionally, this powerful vegetable contains antioxidants including beta-carotene, flavonoids, and polyphenol, which help combat oxidative damage in the kidneys. However, it's important to note that people prone to oxalate-containing kidney stones or those taking blood thinners may need to limit kale intake. While kale is relatively low in oxalate compared to other dark leafy greens such as spinach, it is still considered moderate to low levels, so talk with your doctor. Despite its nutritional benefits, kale is remarkably low in calories, with just 20 calories per cup. It's recommended to consume 1.5 to 2 cups of dark green vegetables weekly, making kale a great choice to meet this goal. You have several options for enjoying kale, whether fresh, cooked, or juiced. This vegetable thrives in cooler temperatures, making it ideal for autumn and winter harvests. It's commonly used in salads, soups, smoothies, and even as a healthy snack like kale chips, adding both flavor and nutrition to dishes. To incorporate kale into meals, you can tear leaves into morning smoothies and use whole leaves as replacements for tortillas or bread and sandwiches. Kale can also enhance the flavor and nutrition of hearty bean soups for dinner. 8. Fish. Almost every kidney-friendly diet recommends eating high-quality proteins, and fish is a great source. 8. Fish. In fact, fish is a highly recommended diet component for individuals with kidney disease due to its rich, high-quality protein content and essential omega-3 fatty acids. While all types of fish provide valuable protein, certain varieties, like salmon, offer particularly high amounts of omega-3s, which are vital for heart, brain, and overall health. Most people with kidney disease or transplants do not need to restrict their fish consumption. However, protein intake must be adjusted based on the stage of the disease, which necessitates consultation with a dietitian. Fresh fish is the preferred option, but individuals with end-stage kidney disease, or ESRD in short, should avoid raw fish and shellfish due to the risk of infections. Similarly, transplant recipients who are more vulnerable to foodborne illnesses due to immunosuppressive medication should steer clear of undercooked fish. In a 2009 study on Acaria Island involving 673 elderly residents aged 65 to 100, researchers aim to explore the link between fish intake and kidney function by looking at their creatinine clearance, or CSAR in short, rate. CCR rate is a measure used to assess how well your kidneys filter waste from the blood. It's calculated by measuring the amount of creatinine, a waste product from muscle metabolism, in a person's urine over a specific period, usually 24 hours. This measurement helps doctors understand how efficiently the kidneys are working. Turning back to the study, scientists saw that 84% of participants consumed more than 150 grams of fish each week. However, about 35% of them concurrently had issues with their CCR when it is less than 60 milliliters. The analysis showed that the more fish people ate, the better their CCR rate tended to be. This result is true even after considering other things like overall diet. Specifically, eating 100 grams of fish each day seemed to increase the chances of having a CCR rate higher than 60 milliliters by 121%. These outcomes suggest regular fish consumption may improve kidney function, especially among the elderly. Fishes are now at higher risk of exposure to heavy metals like mercury, so it's advisable to choose smaller fish and consult local advisories. Additionally, opting for fresh fish over canned varieties helps lower sodium intake, which benefits individuals with kidney disease. 7. Egg white eggs, another great source of high-quality protein, contain all 9 essential amino acids along with essential vitamins and minerals like vitamins A, D, E, K, folate, selenium, B vitamins, and choline. For individuals with chronic kidney disease, or CKD in short, or those who have undergone a transplant, eggs can be a good source of animal protein. Also, they are low in sodium and potassium, which can be beneficial for those managing CKD. Regarding kidney stones, consuming eggs does not impact their formation. However, due to their phosphorus content, it's crucial to monitor phosphorus levels closely when incorporating eggs into the diet. Consult a kidney dietitian to determine the safe intake level. Regarding the concern about phosphorus in eggs, a 2011 study in the Journal of Renal Care showed some interesting results. In this study, researchers looked at maintenance hemodialysis, or MHD in short, patients. MHD is a medical treatment for individuals with end-stage kidney disease, or ESRD in short, who require regular dialysis to filter waste and excess fluid from their blood. In this study, researchers investigated the effects of consuming pasteurized liquid egg whites on the MHD patient's blood serum phosphorus levels. The study involved 13 MHD patients consuming 8 ounces, or about 227 grams, of egg whites daily for 6 weeks. Results showed a significant decrease in serum phosphorus, with an average drop of 0.94 milligrams per deciliter. Serum albumin levels, the main protein found in eggs, also increased slightly. This increase suggests egg whites may effectively lower serum phosphorus without causing malnutrition in MHD patients. So, egg white has the very potential to promote kidney health. 6. Olive oil. Olive oil, especially extra virgin olive oil, or EVOO in short, is rich in phytochemicals, including polyphenolic compounds. In patients with kidney issues, EVOO has been shown to improve kidney function biomarkers, cholesterol levels, and body composition. They can also help reduce oxidative stress and inflammation, which can help reduce kidney disease progression. EVOO, especially the synergy type, which is rich in minor polar compounds, or MPCs in short, can be really helpful for people with kidney problems. It contains substances that fight off harmful molecules and reduce inflammation in the body, which heals kidney issues better. These benefits persist even after stopping its use, highlighting olive oil's lasting positive impact on kidney health. A 2021 study conducted at a nephrology institute involved 40 patients with chronic kidney disease over 9 weeks. They consumed 40 milliliter per day of 2 different extra virgin olive oils. One with high MPC called Synergy and the other with medium MPC content known as Luxolio. The results revealed that both EVOs significantly improved kidney function biomarkers, lipid levels, oxidative stress, and inflammatory parameters in CKD patients. However, the positive effects were more significant and lasted longer in patients who consumed the Synergy EVOO. This result suggests that daily consumption of EVOO, particularly high in MPCs, can have important anti-inflammatory and antioxidant effects, promoting kidney health. Adding olive oil into the diet can be as simple as using it as a salad dressing, drizzling over vegetables, or substituting butter or margarine in cooking. Extra virgin olive oil is high in antioxidants but low in smoke point, so use it for low to medium heat cooking or in dressings to preserve its health benefits. Avoid high heat cooking to prevent burning. In the Mediterranean diet, where EVOO is a primary source of vegetable fats, it has been associated with enhanced kidney function, reduced inflammation, and improved lipid profiles. However, due to its high calorie content, it's crucial to consume olive oil in moderation. For those interested in the evidence, the studies supporting our claims are provided in the link in our description box. 5. Garlic. Garlic, particularly its active compound allicin, offers beneficial effects for healing chronic kidney disease. Allicin helps protect your kidneys by reducing harmful substances, improving their ability to heal and boosting the activity of a key enzyme called superoxide dismutase, which fights off damaging molecules. It also improves kidney function by lowering blood pressure. For example, its blood pressure lowering effect is as good as or better than losartan, a common medication for high blood pressure. A 2021 narrative review in the Journal of Clinical Nutrition highlights the potential benefits of garlic in chronic kidney disease management. Thank you with its potent anti-inflammatory, antioxidant, and antimicrobial properties, garlic has the potential to mitigate complications associated with CKD, including cardiovascular issues and gut dysbiosis. While more research is needed to fully understand garlic's role in CKD treatment, its use as a nutritional intervention shows promise in promoting kidney health and improving patient outcomes. Garlic is generally safe when eaten as part of your diet. However, for people with CKD, it's best to be cautious with garlic supplements. These supplements are more concentrated and contain higher potassium, phosphorus, and sodium levels than fresh garlic, which can be harmful to CKD patients. Possible side effects of garlic include bad breath, body odor, heartburn, and stomach upset, especially when eaten raw. Garlic supplements may also increase the risk of bleeding. Therefore, it's important to talk to your healthcare provider before taking garlic supplements for kidney health. If you decide to consume garlic, it's best to eat it whole as part of your meals. You can make a basic garlic infusion by chopping fresh garlic and blending it with olive oil. It's perfect for dressing salads or cooking veggies, adding flavor without extra salt, which is excellent for kidney health. 4. Blueberries. Blueberries are a great choice for a kidney diet due to their low potassium, phosphorus, and sodium content. They're also rich in fiber, vitamins, and antioxidants like vitamin C, vitamin K, and manganese, which greatly support kidney health. Blueberry has been shown to improve kidney function and reduce oxidative stress, potentially alleviating kidney damage in individuals with metabolic syndrome. Pterostilbene, or PTE in short, a bioactive component of blueberries, has been shown to possess kidney healing functions. It can also lower uric acid levels in the blood, another good news for your kidneys. High blood uric acid levels can lead to gout, kidney stones, and certain kidney problems, so it's best to keep uric acid levels low. A 2018 study in biomedicine and pharmacotherapy investigated the potential of PTE in treating kidney fibrosis and hyperuricemic nephropathy, a kidney condition caused by high levels of blood uric acid. In mice with hyperuricemic nephropathy, PTE treatment reduced markers of kidney damage such as the lower levels of waste compounds like creatinine and uric acid in the blood and albumin in the urine. Also, this treatment greatly lowers kidney scarring called kidney fibrosis by reducing the production of proteins like fibronectin and collagen that contribute to the scarring process. These findings highlight PTE's potential as a promising treatment for healing kidney damage. For optimal kidney health, it is recommended to consume half a cup of blueberries per serving. 3. Onions. Onions, or Allium cepa, are a natural food that can promote kidney health. Low in potassium, phosphorus, and sodium, onions are ideal for those with kidney disease. They contain sulfur compounds that lower the risk of high blood pressure, a common factor in kidney disease. These compounds also give onions their distinct smell. Additionally, onions are rich in quercetin, a potent antioxidant that combats cancer and heart disease. Onion extract has been shown to alleviate the kidneys from toxins like cadmium, maintaining urine volume and kidney function. Furthermore, onions' antioxidants, especially quercetin, can alleviate oxidative stress, contributing to kidney health. A 2021 review article explores how Allium cepa, a type of onion, and its active components might help address various risk factors linked with metabolic syndrome, including high cholesterol, high blood pressure, diabetes, and obesity. When you have these diseases, your risk of kidney disease also increases. So, onions can indirectly help with kidney disease by reducing the risk of metabolic diseases. Onions have antioxidant and anti-inflammatory properties, and they can widen blood vessels. They also affect how the body handles glucose and fats, improving insulin and cholesterol levels. These qualities make onions a hopeful option for healing and treating heart diseases related to metabolic syndrome. However, further clinical studies are warranted to confirm its effectiveness and safety, especially regarding potential interactions with conventional drugs. You can find onion supplements like onion juice online or in local stores. However, eating the actual food is always better for getting health benefits. While your body may benefit from eating onions, their sulfur compounds can cause bad breath and body odor. Cooking onions can reduce their sulfur content. Options like sautéing, caramelizing, frying, or cooking onions can help. After eating onions, you can also try mints or gum to freshen your breath. 2. Red grapes. Red grapes offer kidney-friendly benefits thanks to their low potassium and high fluid content. Packed with flavonoids, they alleviate kidney disease by relieving oxidation and blood clot formation. Resveratrol in red grapes boosts nitric oxide production, relaxing blood vessel muscles for better circulation. Rich in vitamins C and K, grapes support kidney health, along with fiber and essential minerals like copper, manganese, and magnesium. However, their potassium content means moderation is key for CKD patients who are taking potassium-restricted diets. Here is a highlight of how red grapes can help heal the kidneys. particularly through grapeseed extract and whole grape powder. Grapeseed extract supplements can improve kidney function and slow CKD progression by enhancing antioxidant and anti-inflammatory activity. Similarly, whole grape powder intake reduces kidney damage and improves kidney function in diabetic rats, suggesting potential benefits for delaying CKD progression in humans. Furthermore, resveratrol, a polyphenol in grapes, exhibits antioxidant and anti-inflammatory effects, offering promise for managing kidney disease. In a 2022 animal study published in the Journal of Life, red grape juice showed promise in mitigating nephrotoxicity, or kidney damage, and oxidative stress in rats. Scientists administered the rats red grape juice and gentamicin, a drug harmful to kidneys, for 7 days. They found that red grape juice lowered oxidative and nitrosative stress and improved kidney function. The treatment with red grape juice led to positive changes in the structure and appearance of the kidneys when viewed under a microscope. These findings suggest that red grape consumption may be a valuable strategy for combating nephrotoxicity. Although, further studies are needed to determine optimal doses and how they work exactly. Pomegranate. Pomegranates are rich in antioxidants, fiber, essential vitamins, and minerals like potassium, making them a nutritious choice for kidney health. However, their high potassium content means moderation is key for those with kidney issues, especially for hemodialysis patients, because the kidneys can't get rid of extra potassium. Pomegranates may interfere with transplant medications, so transplant recipients should consult their healthcare provider. They also offer potential benefits in healing kidney stones due to their antioxidant compounds. In a 2015 study in Urology Annals, researchers investigated the effect of pomegranate extract on kidney damage in rats with unilateral ureteral obstruction, or UUO in short, which happens when something blocks one of the ureters or the tubes that carry urine from the kidney to the bladder. After 14 days, they evaluated kidney damage under a microscope, and the results showed that pomegranate extract significantly heals kidney damage by reducing oxidative stress. Pomegranates are tasty by themselves, but you can mix them into salads or smoothies, or sprinkle them on yogurt or oatmeal for extra flavor. While pomegranate juice retains antioxidants during cooking, it lacks the fiber found in pomegranate arils. Pairing pomegranates with protein or fat sources can help stabilize blood sugar levels. Precautions while taking natural foods to heal your kidneys. Many kidney-friendly foods like kale, fish, and pomegranates are rich in potassium. While potassium is essential for overall health, too much harms those with kidney issues. Kale also contains oxalates, which can contribute to the formation of kidney stones, particularly in individuals prone to them. Limit intake if you have a history of kidney stones. Eggs, particularly egg whites, are high in protein but may also contain phosphorus, which can be problematic for individuals with kidney disease. Olive oil and garlic offer health benefits, but should be consumed in moderation. Olive oil is high in calories, and garlic supplements may contain high levels of potassium and sodium, which can be harmful to those with kidney issues. Some individuals may be allergic to certain foods, such as fish or onions. Be mindful of any allergic reactions and consult a healthcare provider if you experience symptoms like hives, swelling, or difficulty breathing after consuming these foods. Watermelon, known for its hydrating properties, can be beneficial for kidney health. However, excessive fluid intake can strain the kidneys. In healthy people, drinking 4 to 6 cups of water a day and getting water from food is recommended. But this may vary depending on physical activity, environment, and any medical conditions. Every individual's dietary needs are unique, especially when managing kidney disease. Consult a dietitian or healthcare provider to develop a personalized meal plan that takes into account your specific condition, dietary preferences, and goals for kidney health. Kidney disease is a serious health concern that can cause anemia, weak bones, nervous system damage, and even seizures. On top of that, chronic kidney disease is often detected in its advanced stage, in which your kidneys are severely impaired, affecting normal tasks like filtering blood, removing waste, and controlling blood pressure. So, it's great to understand your condition so that you can detect kidney disease early. Diabetes, high blood pressure, heart disease, family history, and obesity are all contributing to the onset of kidney disease. Note that prevention is even more important than early detection. If you've watched this video up to this point, you would have recognized that adopting a kidney-friendly diet rich in natural foods like kale, fish, egg whites, olive oil, garlic, blueberries, onions, watermelon, red grapes, and pomegranates can play a crucial role in repairing the kidneys and preventing kidney disease progression. By incorporating these natural foods into daily meals, you can take proactive steps towards enjoying a more energetic, motivated, and healthy life. However, it's essential to consume these foods in moderation, as all foods have good and bad elements. Also, be mindful of your individual dietary needs and any pre-existing health conditions. Consulting a healthcare provider or dietitian for personalized guidance is key to optimizing kidney health. Now, we want to send a big thank you to all our current subscribers and viewers. Your support inspires us to continue sharing valuable content. Hit the bell icon and turn on all notifications so you never miss a life-saving video. If you enjoyed this video, we believe you'll enjoy the video on the screen. Here, we share the worst 22 foods that can ruin your effort to heal kidney disease. We also offer tips on how to still enjoy them or find great alternatives. See you there. Stay informed. Stay healthy. 7 common medications that can be harmful for your kidneys. We live in a time of medications. They help us somewhat, but they can also kill us silently. Now, as we age, our kidneys won't work as smoothly. It's important to keep them away from too many chemicals and medicines. But it's challenging because aging often brings a host of health issues and more pills to take. Certain medications can be nephrotoxic, meaning they can cause direct or indirect harm to the kidneys. As a result, the kidney's ability to filter blood diminishes, and harmful waste builds up, leading to serious health issues. Kidney damage severity is measured in stages, ranging from mild dysfunction to complete failure. The risk of kidney damage from drugs, or drug-induced nephrotoxicity, increases as you age and have kidney conditions. There are 2 main types of kidney damage from medications: dose-dependent toxicity and idiosyncratic toxicity. Dose-dependent toxicity means that damage increases with higher doses. In contrast, idiosyncratic toxicity is unpredictable and varies greatly between people. Sometimes, it's best to avoid these drugs altogether. Drug-induced nephrotoxicity can result from muscle tissue breakdown, or rhabdomyolysis, kidney tissue death, or renal infarction, and acid buildup, or renal tubular acidosis. This can result in decreased kidney function and other conditions like nephrotic syndrome or electrolyte imbalances. In this video, we'll explore the impact of common medications on kidney health and provide practical tips for managing these drugs safely. Remember, understanding the risks associated with them can empower you to make informed decisions about your health care. Stay tuned and learn how to protect your kidneys while effectively treating other medical conditions. Before we dive in, kindly note that all information you'll find in this video is produced by humans, and for humans. You can visit our website at healthtoday.com to see our advisory board and the team behind these videos. We do not use artificial intelligence writing tools like ChatGPT to automatically generate content. Be assured, our information is thoroughly fact-checked, unbiased, and reviewed by qualified professionals. Alright, it's time to swing back to the medications that can be harmful for your kidneys. 7. Antibiotics. Antibiotics are prescribed often, but they are not without risk. Does your doctor prescribe antibiotics for your sore throat, skin infection, or other infection? If so, it could be harming your kidneys. First, let's take a look at what antibiotics are. Antibiotics, also known as antibacterials or antimicrobials, are a group of medications designed to combat bacterial infections. They work either by killing bacteria or preventing them from reproducing. You can find common antibiotics with the brand names like Cipro, Augmentin, Flagyl, Bactrim, or amoxicillin. These drugs could be prescribed to treat strep throat, pneumonia, urinary tract infections, or UTIs in short, or skin infections. Antibiotics can treat these bacterial infections, but they can't treat viral infections, such as colds, flu, bronchitis, most coughs, and most sore throats. So, you should be extra cautious when your doctor prescribes antibiotics. If prescribed improperly, you might experience side effects such as diarrhea and liver and kidney problems. Even when properly used, some antibiotics such as polymyxins, aminoglycosides, and vancomycin can harm your kidneys. Simply put, your kidneys play a crucial role in removing antibiotics and other drugs from your body. But beware, antibiotics like polymyxins may damage kidney cell membranes, possibly causing kidney injury. Similarly, another antibiotic, aminoglycosides, can accumulate in kidney cells, causing cell death and harming kidney tubules. In general, the mechanism by which each antibiotic causes kidney injury is still not fully understood, but it might involve inflammation and harm to kidney cells. For antibiotics to be effective and safe for kidney health, it's important to use them correctly. Did you know that nearly 1/3 of antibiotics prescribed in the United States aren't even appropriate for the conditions being treated? That's according to a report from the Centers for Disease Control and Prevention, or CDC in short, in a study published in the Journal of the American Medical Association. Before you ask for an antibiotic or if your doctor prescribes one, knowing which conditions they can treat is important. You can ask them, "Is this necessary?" And most doctors will gladly explain why it's needed. If antibiotics are truly needed, follow the dosage exactly as instructed and adhere to any food requirements. Even if you feel better, never save antibiotics for future use or give your prescribed antibiotics to someone else, as prescriptions are tailored to individual health needs and conditions. Are you enjoying our video so far? If so, please give us some hints by dropping a like, and we'll make more content like this. 6. Non-steroidal anti-inflammatory drugs, or NSAIDs in short. Some may not recognize non-steroidal anti-inflammatory drugs, but have you heard of ibuprofen, aspirin, Motrin, Ketorolac, Telecoxib, or naproxen? Yes, they're all NSAIDs, and you can purchase some of them without a prescription. In fact, NSAIDs are very common. Over 30 million people take them daily. NSAIDs are commonly used to ease headaches, sprains and strains, colds and flu. Pain from arthritis at their core. NSAIDs mainly work by blocking an enzyme called cyclooxygenase, or COX in short. This enzyme helps produce pain-causing substances. However, COX is also important for protecting the kidneys during stress and helping regulate sodium and water excretion. So when NSAIDs block COX, it's a big reason why these drugs can harm your kidneys. In fact, all NSAIDs can cause acute kidney injury, or AKI in short. Especially in older people, and when taken in high doses or over extended periods. This injury appears in two main ways. One because blood flow changes, and the other because of inflammation. Both caused by blocking COX. First, blocked COX can narrow kidney blood vessels, reducing blood flow. This can lead to fluid retention, high blood pressure, and even mild temporary kidney impairment. If this goes unchecked, it might cause more severe issues like acute tubular necrosis, where kidney tubules die due to lack of oxygen, and acute kidney failure. Even though this can initially look like acute kidney failure, it could eventually progress to chronic kidney disease. Second, although NSAIDs are anti-inflammatory drugs, prolonged use can trigger inflammation in kidney tubules, the tiny structures that filter waste. This inflammation is rare, but overall, kidney issues stemming from NSAIDs are a big concern, affecting 1% to 5% of daily users worldwide. This means that each year, around 500,000 to 2.5 million people experience kidney injury from NSAIDs. What's worse, these drugs are often involved in hospital admissions because of adverse drug events, some of which can be deadly. A 2006 study published in the Journal of the American Society of Nephrology analyzed data from over 184 people who were prescribed NSAIDs for various conditions. The results showed that NSAIDs use raised the risk of acute kidney injury by 26%, especially within the first 30 days of use. This result emphasizes the need for caution when prescribing and using these medications. In another study, scientists looked at 99 patients with chronic musculoskeletal pain who took NSAIDs for 12 months. They found that most patients' kidney function decreased after NSAIDs use but returned to normal after switching to another pain reliever drug. For those interested in the evidence, the studies supporting our claims are provided in the link in our description box. Now, the next set of drugs on our list might surprise you, because they're typically considered pretty good for your kidneys. 5. Diuretics. Diuretics help with conditions like fluid retention or swelling, often seen in heart and kidney failure, and liver cirrhosis. Some diuretics are available over the counter, but prescription diuretics are typically stronger. Common diuretics include hydrochlorothiazide, or HCTZ, bumetanide, and Bumex, furosemide, sold as Lasix, spironolactone, found in aldactone, and acetazolamide and Diamox. They work by increasing urine output. They're also good for expelling excess salt and water through urine, which can help with hypertension or high blood pressure, a leading risk factor for kidney disease. Thus, diuretics are generally suitable for your kidneys. While diuretics are beneficial overall, they don't come without risks, especially concerning kidney health. In fact, they don't directly damage the kidneys or affect their filtering function like NSAIDs. Instead, they act further down the kidney's process, altering the urine's concentration and composition. This increases the amount of urine or changes the levels of electrolytes in it. So, excessive use or high doses of diuretics can lead to dehydration, a risk factor for kidney damage. A study looked at 131 patients using diuretics and having acute kidney injury from 1999 to 2010 at a hospital. At first, 96.2% of the patients already had at least one health issue before starting diuretics. With chronic kidney disease, or CKD in short, being the most common at 55%. They found that patients who used diuretics had higher rates of kidney disease and its risk factors like hypertension and diabetes. The higher the dose, the bigger the risk. Also, about 27.5% of the cases of acute kidney injury were caused by diuretics alone, while others were due to a combination of diuretics and other drugs. So always consult your doctors before starting new medications with diuretics. For people with CKD who are taking diuretics, it's important to stay hydrated and regularly check for electrolytes and kidney function. Nowadays, there are more home testing options available than ever before. So people can now check their kidney function from the comfort of their own homes. For proton pump inhibitors. Proton pump inhibitors, or PPIs in short, are widely used medications available over the counter. These drugs effectively treat conditions like gastroesophageal reflux disease, or GERD in short, or acid reflux by reducing stomach acid production. This is because PPIs target an enzyme in the stomach called hydrogen potassium ATPase, or proton pump, which is crucial for acid secretion. Although PPIs are generally safe and great at soothing acid-related discomfort such as heartburn, they still carry risks, particularly for kidney health. For example, PPIs have been linked with acute interstitial nephritis, or AIN in short, a kidney disorder characterized by inflammation in the spaces between the kidney tubules. Even though only a tiny number of PPI users develop AIN, this drug has become a common cause of drug-induced AIN in developed countries. More concerning, AIN caused by PPIs often shows no apparent signs and often goes unnoticed. So, long-term PPI use may lead to lower kidney function and acute sudden kidney injury. Over time, this can even progress to CKD. An often overlooked side effect of long-term PPI use is low magnesium levels in the blood or hypomagnesemia, which is linked to CKD. Simply put, hypomagnesemia can disrupt your electrolyte balance and cause inflammation, triggering kidney disease. Low magnesium can also lead to other serious health problems, including muscle spasms, seizures, and irregular heartbeats. A 2019 cohort study in the Journal of Pharmacotherapy investigated the effects of PPIs on kidney function. This study checked how PPI use relates to new cases of acute kidney injury, or AKI in short, and chronic kidney disease in a large group of people. When they examined a group of 335 people, they found that those taking PPIs had a 4.35 times higher risk of AKI compared to those who didn't. Similarly, taking PPIs was linked to a higher risk of CKD. When researchers examined a group of 600 people, PPI users had a 1.2 times higher risk of CKD compared to non-users. So, people taking PPIs should have regular checkups to monitor their kidney function and magnesium levels. After all, don't let the solution to one problem become the source of another. While PPIs can provide significant relief from acid-related issues, long-term use of them can harm your kidneys and cause other problems, such as infections, fractures, or nutritional deficiencies. So, it's important to take PPIs for the shortest time possible to relieve acid-related issues without raising the risk of side effects. 3. ACE inhibitors. Angiotensin-converting enzyme, or ACE in short, inhibitors, are prescription medicines widely prescribed to lower blood pressure and manage conditions affecting the heart, blood vessels, and kidneys. Common ACE inhibitors are lisinopril, sold as Zestrel, Prinavil, Remipril, found in Altace, Enalapril, in Vasitec, and Benazepril, in Lotensin. These drugs work by blocking an enzyme that produces angiotensin II, which narrows blood vessels and increases blood pressure. By stopping this enzyme in its tracks, ACE inhibitors help relax blood vessels, thereby lowering blood pressure and reducing stress on the heart. Normally, ACE inhibitors also improve blood flow to the kidneys, easing the workload on these vital kidney-shaped organs. This enhanced blood flow can protect the kidneys, especially over the long term. Moreover, ACE inhibitors may help reduce the presence of protein in the urine, a common problem in chronic kidney conditions. In fact, ACE inhibitors are commonly recommended for people with kidney disease. While these medications boast protective benefits, they're not without risks when you mix them with NSAIDs and diuretics. Your risk of AKI can increase. Also, when you don't drink enough water to meet your body's needs, taking ACE inhibitors can put you at more risk of AKI. If you're concerned about your risk of AKI when taking these drugs, it's best to talk to your doctor about ways to lower it. Some people are concerned that ACE inhibitors might decrease your estimated glomerular filtration rate, or EGFR. Typically, a higher EGFR suggests better kidney function. However, ACE inhibitors reduce EGFR by relieving pressure on the kidneys, allowing the small filters, called glomeruli, to relax. While this may cause a slight decline in EGFR, it doesn't indicate kidney trouble. It simply means the kidneys are relaxing. However, sometimes, EGFR may drop too much. This is especially risky in patients with heart failure, chronic kidney disease, or blockage in both renal arteries, or bilateral renal artery. If this occurs, your doctor may adjust your dosage or stop the medicine temporarily to find the cause. Note that in rare cases, particularly in patients with conditions like heart failure or severe dehydration, ACE inhibitors can cause acute renal failure. However, once stopping the medication, most patients recover without lasting kidney damage, even after needing dialysis. So, patients with heart failure, diabetes, or CKD benefit from ACE inhibitors because they ease the strain on the kidneys and offer long-term kidney protection. However, dosages should be adjusted carefully, and kidney function should be regularly checked. 2. Antiviral drugs. Most viruses clear up without antiviral drugs, but doctors prescribe them for serious or long-lasting infectious diseases like COVID-19, Ebola, flu, genital herpes, hepatitis B and C, and HIV. These drugs can clear the flu and combat other viruses from your body. For a flu, two common antiviral drugs are oseltamivir, Tamiflu, and zanamivir, Relenza. In contrast, for chronic infections like HIV, hepatitis, and herpes, antivirals can't cure them completely, but they can ease symptoms and reduce their severity. Antiviral drugs offer many benefits in treating viral infections. Yet their potential to harm the kidneys cannot be overlooked. This risk, whether from direct toxicity or crystal buildup that can cause kidney stones, is a serious concern. Careful management and customized treatments are necessary, especially for people with existing kidney problems. Let's take, for example, remdesivir, a drug for emergency use in COVID-19 cases. Remdesivir contains a substance called SBCD, which is mainly removed from the body by the kidneys. In people with kidney issues, SBCD might build up and cause kidney toxicity. Some clinical trials have inconsistently reported a decrease in kidney function with remdesivir. Moreover, data from global databases showed a significant increase in cases of acute kidney failure associated with remdesivir compared to other COVID-19 drugs. However, there hasn't been enough large-scale clinical data to confirm whether remdesivir is safe or harmful for people with kidney issues. So further studies are necessary to provide clarity in this area. Besides remdesivir, the use of more effective antiviral drugs often leads to drug-induced acute kidney injury. Some antiviral drugs like cetofovir, adafovir, fosarnet, acyclovir, interferon, and tenofovir can directly cause cell death in kidney tubules by reducing blood flow or increasing toxins. This condition is called acute tubular necrosis. Additionally, the antiviral drug atazanavir can cause inflammation in the interstitial tissue of the kidneys, impairing kidney function. Also, acyclovir, indinavir, and foscarnet can cause crystals build up in the kidneys, blocking the kidney tubules. In contrast, some antiviral drugs like viride and foscarnet can help manage kidney damage, but they also pose a notable risk of kidney failure. Therefore, taking these drugs under close medical supervision is crucial to safeguard the kidneys. Also, to safely use antiviral drugs, never skip doses or inconsistently take them. This practice can lead to virus adaptation, making the antiviral less effective. This is called antiviral resistance. Also, note that antiviral drugs are only available with a prescription, so don't buy them online or from unofficial sources. 1. Lithium. Lithium is a prescription medication for mood stabilizing and certain mental illnesses. These mental problems include mania, where one feels highly excited, overactive or distracted, and bipolar disorder, which causes mood swings between extreme highs, also known as mania, and lows or depression. Some brand names of lithium are Priadil, Camcolit, Lisconum, and Leliquid. For over 60 years, these drugs have enhanced the lives of many individuals suffering from bipolar disorder. While lithium can be a lifeline for calming mood, its impact on the kidneys cannot be ignored. Long-term use of lithium can lead to some serious kidney issues, including both acute and chronic kidney disease, as well as kidney cysts. Early on, kidney damage from lithium might be reversible, but it could become permanent with time. The main issue with lithium use is a type of diabetes linked to kidney damage called nephrogenic diabetes insipidus. This isn't your typical diabetes caused by high blood sugar. In this condition, your kidneys can't respond properly to a hormone called antidiuretic hormone, or ADH, which controls fluid balance. The result? One may have excessive thirst and too many trips to the bathroom. In rare cases, long-term use of lithium can even lead to end-stage renal disease, or ESRD. Symptoms of kidney trouble from lithium include excessive urine output and thirst, frequent nighttime urination, and signs of dehydration like low blood pressure and fast heartbeat. In severe cases, it can cause changes in mental status. Moreover, lithium can make the kidneys excrete too much sodium, a condition known as hyponatremia. Sudden hyponatremia, where sodium levels drop quickly in less than 48 hours, can cause serious problems if not treated, including life-threatening muscle breakdown, rhabdomyolysis, severe confusion, seizures, coma, and even death. So, patients should maintain a regular diet with enough salt and fluids while taking lithium. Moreover, when on lithium, it's important to define a suitable dosage. Get yearly blood tests to check creatinine levels and seek medical help if anything seems wrong. Lithium can harm you in many ways, not just by damaging kidneys. So, before starting it, let your doctor know if you have kidney, heart, thyroid, or breathing problems. Addison's disease or Brugada syndrome. Extra tips for cautious use. Do you suspect that your medication is affecting your kidney health? It's important to seek medical advice right away. Symptoms of kidney failure might not be apparent initially, but as the condition worsens, signs such as decreased urine output, swelling in the legs, shortness of breath, and severe fatigue become more evident. If untreated, the consequences can be life-threatening. Let's ensure you remember these symptoms to know when to act. If you are taking any of the medications that have been discussed in this video, check your kidney function regularly using tests that include blood creatinine levels, glomerular filtration rate, or GFR in short, and urine tests for protein. Proper hydration helps your kidneys clear sodium, urea, and toxins from the body, which can mitigate the impact of nephrotoxic drugs. Be aware of potential interactions between your prescriptions that could impact your kidney health. Share all your current medications with any healthcare provider who prescribes a new drug. Yes, medications are essential for treating various medical conditions. Yet certain drugs pose significant risks to kidney health and should be used cautiously, especially in individuals with existing kidney disease or those predisposed to kidney disease. Antibiotics, NSAIDs, diuretics, proton pump inhibitors, ACE inhibitors, antiviral drugs, and lithium all have the potential to impair kidney function through mechanisms ranging from direct toxicity to effects on renal blood flow and electrolyte imbalances. For those with kidney disease, it is crucial to avoid or carefully manage the use of these medications. Patients should work closely with healthcare providers to select treatments that minimize risk to the kidneys, adjust dosages as necessary, and monitor kidney function regularly. A healthy lifestyle can help you keep medication to a minimum. Try to eat a balanced diet with lean protein, fruits and vegetables, and exercise regularly to protect your kidneys from any damage. And if you're serious about mastering your kidney health and understanding how the body works, make sure you subscribe to us. Hit the bell icon and turn on all notifications so you never miss a life-saving video. If you enjoyed this video, we believe you'll enjoy the video on the screen. We share the worst 18 habits that may be harmful to your kidneys and tips to avoid them. See you there. Stay informed. Stay healthy. Eat these 8 herbs to boost kidney cleanse and detox. The beneficial effects of herbs on kidney function are increasingly being noticed, particularly in conditions like diabetic kidney disease or kidney disease caused by diabetes. This is attributed to specific antioxidants found in herbs, such as polysaccharides, flavonoids, xanthines, and peptides. These compounds also have demonstrated potential in cleansing your kidneys. Simply put, their antioxidants help cleanse your kidneys from harmful molecules called free radicals, the major causes of kidney disease. When we eat or live unhealthily, our kidneys can become overwhelmed with toxins like heavy metals or free radicals. These toxins accumulate for years, so forget about any 3-day routines or fancy supplements for kidney cleansing. These methods can be risky and offer little, if any, help. We covered this topic extensively in our previous video, so we highly recommend you to check it out for more details. And for now, the best thing you can do for your kidneys is eating more antioxidant-rich foods like herbs. Herbs can also address prolonged high blood sugar, drug toxicity, and oxidative stress, which are common factors associated with kidney injury. Plus, herbs are effective in lowering blood pressure and enhancing cardiovascular functions, all of which are often compromised in chronic kidney disease, or CKD in short. Note that excessive salt intake has been linked to kidney damage. Hence, exploring alternatives to traditional seasoning becomes crucial for your kidney health. Herbs with their diverse flavors and kidney benefits, as we've just discussed, can serve as excellent substitutes for salt in cooking. We're here to help you explore the top 8 herbs that can help with kidney cleansing, how they benefit kidney function, and how they keep your kidneys cleansed, healthy, and robust. These herbs can also lighten the load on your kidneys, keeping them clean from the beginning. And the best part? They're delicious and easy to add to your meals. Before we dive in, kindly note that all information you'll find in this video is produced by humans and for humans. You can visit our website at healthtoday.com to see our advisory board and the team behind these videos. We do not use artificial intelligence writing tools like ChatGPT to automatically generate content. Be assured, our information is thoroughly fact-checked, unbiased, and reviewed by qualified professionals. Alright, it's time to swing back to the herbs that can help cleanse your kidneys. 8. Dandelion. Dandelion, or Taraxacum officinale, a member of the Asteraceae family, grows abundantly across the northern hemisphere in various environments. 8. Dandelion. This plant is not just a weed, it is known for versatile health benefits and abundant bioactive compounds, particularly antioxidants, such as sesquiterpene, lactones, phenolic acids, and inulin. Antioxidants can help neutralize harmful free radicals in the kidneys, safeguarding your kidneys from free radicals and oxidative stress. Some common antioxidants in dandelions, such as sesquiterpene, lactones, and phenols, also have anti-inflammatory effects. This property helps relieve kidney-damaging inflammation and foster optimal kidney function. Dandelion is also packed with a rich array of vitamins, minerals, and phytochemicals. Medicinally, with its bioactive ingredients, dandelion is highly valued for its contributions to kidney, liver, and gallbladder health. A 2010 study in the International Journal of Immunopathology and Pharmacology examined dandelion extract for its antioxidant and protective effects against induced oxidative stress. The extract showed notable effectiveness against free radicals and oxidative stress. These findings suggest that dandelion can aid in kidney cleansing as part of herbal formulations. Moreover, dandelions act as natural diuretics. Aiding more urine production, this helps kidneys flush out toxins and waste from your body. However, due to their diuretic effect and high potassium content, dandelions are not recommended for patients with severe chronic kidney disease. Still, dandelion enjoys global recognition in culinary traditions, featuring in salads, soups, and even wines. Its leaves can be enjoyed raw or cooked, and its roots and flowers are used for teas. Dandelion is considered safe by the U.S. Food and Drug Administration, or FDA in short. However, some people might be allergic to certain dandelion compounds, which could cause a skin rash or, rarely, an allergic reaction. If you're allergic to honey or plants like ragweed, daisies, chrysanthemums, sunflowers, or marigolds, it's best to avoid dandelions. Traditional Chinese medicine also suggests that dandelions are not good for people sensitive to cold. Note that too much of anything can cause adverse effects, but it is uncertain how much dandelion is unsafe. So, it's wise to begin with a small amount and see how your body responds. If you have any more concerns regarding dandelions as well as other herbs, we provide precautionary information at the end of this video. Make sure to check it out because this information is important. Are you enjoying our video so far? If so, please give us some hints by dropping a like, and we'll make more content like this. 7. Parsley. parsley is a staple in culinary traditions worldwide. This biennial plant is from the Apiaceae family. Anise, celery, fennel, and carrot are also part of this family, which has distinct flowers arranged in umbels. Regarding parsley, this herb's essential oils are rich in antioxidants, such as flavonoids and polyphenolic compounds. It's renowned for its diverse medicinal properties, such as being diuretic, anti-inflammatory, and antioxidant. These effects make parsley valuable in treating urinary tract disorders due to hypertension. But wait, how can this herb do so? Parsley can block the sodium-potassium ADPase, a pump found in the cells of the kidney tubules. This pump usually helps your body absorb sodium and potassium. But parsley can slow it down. As a result, more sodium and potassium stay in the kidney tubules instead of being absorbed back into your body. This makes the tubules more concentrated with these minerals. To balance things out, water from the cells flows into the tubules, making more urine. So, like dandelions, parsley makes you urinate more. This is why people with CKD should not take parsley. Let me repeat that. Parsley helps those prone to urinary tract infections or kidney stones. In a 2009 study published in the Brazilian Journal of Pharmacognosy, researchers investigated the diuretic effects of parsley extract on rats, reflecting its traditional use in Brazilian folk medicine. They tested this on 19 anesthetized Wista rats, giving them either filtered water or parsley extract by mouth. The rats given parsley extract showed higher urinary flow, more sodium and potassium in their urine, along with lower blood pressure. These effects may help take some workload off their kidneys. So, this study supports parsley's potential to improve kidney health. Parsley is a versatile and cheap way to add flavor to your dishes. To boost their flavor, you can use dried parsley in many recipes, like soups, stews, and tomato sauces. Fresh parsley is perfect for making homemade salad dressings, marinades, and seafood dishes. You can also add fresh sprigs to dishes that don't need cooking, or sprinkle them on at the end of cooking. To keep fresh parsley longer, wrap it in a damp paper towel, and store it in a closed container in the fridge. For those interested in the evidence, click the studies supporting our claims are provided in the link in our description box. 6. Turmeric. Turmeric, derived from the root of curcumolanga, contains curcuminoids like curcumin, which have been extensively studied for their therapeutic potential. Plus, research suggests that turmeric may have potential benefits for kidney health due to its anti-inflammatory and antioxidant properties. Also, traditional medicine uses turmeric for urinary tract infections, liver issues, and digestive disorders, further suggesting it could promote kidney health. Adding turmeric to your diet may offer a natural way to support overall kidney function and health. Plus, curcumin and turmeric can help improve gut health and counter inflammation. This can indirectly benefit the kidneys because a healthy gut and reduced inflammation can help decrease oxidative stress, which is often linked with chronic kidney disease, or CKD in short. Additionally, curcumin's anti-inflammatory properties may directly alleviate inflammation in the kidneys, potentially slowing the progression of CKD. One bonus point with curcumin is that it is easily absorbed by the body, making it highly effective in plasma, urine, and tissue. This quality is known as high bioavailability. In a 2022 meta-analysis in the Journal of Functional Foods, researchers investigated how taking curcumin affects blood creatinine levels in patients with inflammatory diseases. Creatinine is a waste product formed from muscle breakdown and is filtered by the kidneys and expelled in urine. So, more blood creatinine implies your kidneys are not working well to filter them, making them a key measure of kidney function. Analyzing 14 studies, scientists found that oral curcumin supplementation led to a significant decrease in creatinine levels. Notably, the positive impact was more pronounced in trials with longer durations when people took curcumin. This suggests that curcumin, the active compound in turmeric, could be crucial for promoting kidney health. So, unlike dandelion and parsley, turmeric is beneficial for CKD patients. However, if you have oxalate kidney stones, eat it in moderation. Turmeric is usually fine for other types of kidney stones, so it's best to ask your urologist about your specific type of stone if you have one. Studies typically recommend doses of 500 to 2,000 milligrams of natural turmeric or its extract per day for overall health. But there has not yet been a specific human study on kidney disease. You can get more curcumin from an extract than from natural turmeric. For example, the average Indian diet provides about 2,000 to 2,500 milligrams of turmeric per day, which equals around 60 to 100 milligrams of curcumin. Turmeric spices contain about 3% curcumin, whereas extracts contain around 95%. However, turmeric can still offer benefits when used as a spice. 5. Ginger. Ginger, originating in Southeast Asia and widely used as a spice and condiment worldwide, is a member of the Zingiberaceae family. This family comprises aromatic perennial herbs, such as ginger, turmeric, cardamom, and galangal. Among them, ginger's root has been utilized in traditional herbal medicine phytonutrients. Some of these compounds are gingerols, shogols, pyridols, and zingerone, which offer various health benefits. Additionally, ginger has anti-inflammatory, antioxidant, and antimicrobial properties, making it a versatile ingredient with potential health-promoting effects. Using ginger as a seasoning can prove beneficial effects, especially for kidney health. Ginger adds flavor to dishes without increasing sodium intake, which is crucial for individuals with chronic kidney disease, or CKD. By reducing salt intake and incorporating ginger into recipes, you can enjoy flavorful meals while helping your kidneys. Plus, ginger's anti-inflammatory properties may offer extra benefits for kidney function compared to salt. A systematic review in 2022 examined how ginger extract can protect the kidneys in diabetic kidney disease. The study looked at 41 articles and found that ginger supplementation significantly decreased blood glucose levels in 28 studies and reduced malondialdehyde, or MDA in short, levels in 9 studies. MDA is a type of biomarker that measures the amount of oxidative stress present in the body. So, a reduced MDA level through ginger supplementation suggests that ginger may effectively mitigate oxidative stress in the body, including the kidneys. Also, in several studies, ginger lowered serum creatinine, total cholesterol, and triglycerides, all of which benefits kidney health. This indicates the role of ginger in lowering blood sugar, lipid levels, inflammation, oxidative stress, and kidney injuries associated with diabetic kidney disease, highlighting its promising role in promoting kidney health. 4. Stinging nettle. Stinging nettle, a perennial herbaceous plant with spiny leaves, is native to the western United States and has been used in herbal medicine for centuries. Ancient Egyptians used it for arthritis and back pain, and Roman soldiers applied it to keep warm. Rich in fiber, minerals, vitamins, and antioxidants, stinging nettle has shown promise in promoting kidney function and cleansing. Its anti-inflammatory and antioxidant properties may help alleviate conditions such as urinary tract infections, or UTIs in short, and kidney stones. Plus, its diuretic effects can support flushing toxins from the kidneys. So, the use of stinging nettle as a remedy may offer a natural approach to supporting kidney health and cleansing. Also, stinging nettle can treat urinary symptoms of an enlarged prostate or benign prostatic hyperplasia, or BPH in short, in older men. In Europe, stinging nettle root is widely used for this purpose. Some research shows that stinging nettle is as effective as finasteride, a common BPH medication, in slowing prostate cell growth. Plus, studies suggest that stinging nettle, often combined with saw palmetto, can help with reduced urine flow, incomplete bladder emptying, post-urination dripping, and frequent urges to urinate. However, it's important to consult a doctor before using stinging nettle as a remedy for BPH. The ability of nettle to prevent kidney stone formation lies in its bioactive phytochemicals, such as flavonoids, anthocyanins, and saponins. These compounds inhibit calcium and oxalate buildup and crystal growth, which are the components of kidney stones. Some researchers investigated the antioxidant effect of nettle extract on male rabbits given gentamicin, a medication that can harm the kidneys. Gentamicin causes kidney damage and increased toxin levels in untreated rabbits. However, rabbits treated with nettle extract alongside gentamicin showed protective effects with no significant kidney damage observed. This suggests that nettle extract has a strong antioxidant ability and could play a crucial role in promoting kidney health by mitigating oxidative stress. Eating dried or cooked stinging nettle is usually safe with few side effects. However, be cautious when touching fresh stinging nettle leaves because their tiny hairs can sting your skin. Pregnant women should avoid stinging nettle as it might cause uterine contractions, which could increase the risk of miscarriage. 3. Juniper berries. Juniper berries, derived from the evergreen aromatic shrub Juniperus communis L., are rich in antioxidants and anti-inflammatory agents. This herb has been historically used for its diuretic, antiseptic, and anti-inflammatory effects. Juniper berry oil contains alpha-pinene, a potent compound with proven effects on both lab and animals. Juniper increases urine output without losing electrolytes, mainly due to its essential oil and hydrophilic components, which can easily dissolve in or interact with water. Specifically, terpenin 4-OL increases the glomerular filtration rate, or the rate of urine filtered. A 2020 study in the Clinical and Experimental Health Sciences investigated the effects of juniper berry oil on kidney dysfunction in diabetic rats. They divided 28 rats into groups, including rats untreated or treated with juniper oil. Results showed that diabetic rats treated with juniper oil had better kidney function compared to untreated rats. So, this study provides evidence of juniper berry's potential to improve kidney health and diabetic conditions by reducing oxidative stress and improving kidney function. However, excessive and prolonged use of juniper may irritate the kidneys, especially in cases of underlying kidney issues. However, studies showed mixed results, so if irritation does occur, it's important to consult a doctor for specific guidance. In this case, it would help if you cut down on the irritant, which is juniper. Plus, you can also drink plenty of water to alleviate the effects. Also, as juniper berries are diuretic or make you urinate more. Be cautious. Kidney disease patients often need to limit water intake to avoid water retention. Stop taking juniper berries if you notice any side effects. 2. Corn silk. Corn silk is the thin, shiny threads between the husk and ear of corn. Each ear of corn can have hundreds of these strands, which are essential for pollination and kernel growth. Corn silk, used in both Native American and traditional Chinese medicine, has been in human studies shown to lower blood pressure and help manage diabetes. Note that high blood pressure and diabetes are major risk factors for kidney disease. Extract from corn silk can also have a positive impact on kidney health by acting as a diuretic, increasing urine flow, and potentially preventing urinary tract and bladder infections. Additionally, it may help prevent kidney stones and protect against kidney damage from certain medications. Simply put, it contains bioactive compounds such as flavonoids, which contribute to its antioxidant capacity. Furthermore, corn silk has been studied for its potential to lessen kidney damage caused by substances like gentamicin, a common antibiotic known for causing kidney damage in some cases. While corn silk shows a protective effect against certain kidney injuries, higher doses may lead to toxins build up in the kidneys. You can add fresh corn silk into your diet as a topping on salads, potatoes, soups, and tacos. You can also use it to make corn silk tea by simmering fresh or dried corn silk in water for about 10 minutes, then letting it steep for an additional 30 minutes. After that, strain it and enjoy hot or cold. Cleavers, scientifically known as Gallium aperine, are a herbaceous plant rich in phytonutrients such as phenols, tannins, alkaloids, anthraquinones, coumarins, and flavonoids. Their diuretic properties, which can help increase urine flow and potentially support kidney function, are believed to aid in kidney cleansing. Additionally, some extraction of cleavers demonstrated strong antioxidant activity, particularly the aqueous fraction. Antioxidants can support kidney health by reducing oxidative stress, which is implicated in kidney damage, as we mentioned before. The high phenolic and flavonoid contents in the aqueous fraction contribute to its antioxidant properties, protecting against kidney damage caused by free radicals and oxidative stress. Therefore, incorporating cleavers, especially its extract, into a kidney cleansing diet could help promote kidney health. In 2006, a study from the Yasuj University of Medical Sciences looked at the kidney damage caused by cisplatin. This powerful anti-cancer medication is toxic to kidneys, and scientists wanted to see whether cleaver extract could help. The study was conducted using 70 rats randomly divided into groups. The rats were treated with different doses of cisplatin and cleaver extract, and their kidneys were examined. The results revealed that all drug-treated groups had increased mean glomerular volume, indicating kidney damage. However, groups receiving higher doses of cleaver extract showed less severe kidney enlargement. Thus, cleaver extract shows promise as a protective agent against cisplatin-induced kidney damage. With their sticky hooks, cleavers are best utilized in teas rather than consumed raw. Cleavers have also been traditionally used to treat conditions like cystitis. Precautions when using herbs for kidney cleanse. Now, we know that herbal medicine presents alternative therapies for various conditions, including chronic kidney disease, or CKD in short. However, caution is warranted as certain herbs, such as bergantia and asarum, contain aristolosic acid that can worsen kidney disease. The herbs we're suggesting today generally don't contain this substance and are generally safe. However, not all herbs are safe to use as therapy, so it's best to consult a healthcare professional before you use a new herb, especially if you have a health condition. This is because some herbs may interact with your current medications, especially anticoagulants, antihypertensives, and diuretics. They can either increase or decrease the effect of these medications. If you are taking these medications, consult your doctor for personalized advice. You should inform your doctor whether you use these herbs before or while taking these medications. This information is crucial, as it could lead to unexpected and potentially hazardous outcomes for you and your healthcare providers. Moreover, herbal supplements sourced from different countries may contain heavy metals, such as grains of salamine acid, posing a risk to kidney health. In some instances, herbal supplements can interact with prescription medications, potentially altering their effectiveness and impacting kidney function. Also, some herbs contain high levels of potassium or phosphorus, which should be restricted or added carefully under a healthcare professional's guidance for people with kidney disease, particularly those undergoing dialysis. Notably, some herbs function as diuretics, potentially aggravating or harming the kidneys, especially if their function is compromised. What is more, the FDA does not regulate herbal supplements for dosage, content, or purity. And there is limited research on how well they work, particularly in patients with kidney disease. Patients with kidney disease may have other health concerns from herbal supplements, such as bleeding disorders, which increase the susceptibility to adverse reactions. Special caution is advised for pregnant or lactating women and children. Certain herbs, like dandelion, parsley, and cleavers, support kidney health with their diuretic properties, while ginger adds flavor without salt. Turmeric's curcuminoids and stinging nettle can help prevent stone formation, and juniper berries and corn silk prevent urinary tract infections. To detoxify the kidneys, focus on hydration, a balanced diet, and limiting sodium intake. Those with kidney disease should be cautious of herb contents. Make sure to inform your healthcare provider about any supplements you're using. And if you're serious about mastering your health and understanding how the body works, make sure you subscribe to us, hit the bell icon, and turn on all notifications so you never miss a life-saving video. If you enjoyed this video, we believe you'll enjoy the video on the screen. Here, we share the 5 best fruits to help cleanse your kidneys and tips for using them. See you there. Stay informed. Stay healthy.